Wake up, Lehigh Valley, Allentown, Warminster, and Philadelphia. I'm Chris.
And I'm Michelle.
And today we're talking about
vaginas.
And I don't know much about those. So I'm going to step out and thanks to...
Wait, what do you mean? You want to talk about a vagina?
Not really. Last time I thought I talked about one was when I was born, and I don't remember that at all. So I'm going to step out and let Katie come in, and we're going to talk about the O-shot today, which we'll talk about the name later, and about core intima. So this is your warning if you've got children watching with you or you're at work with loud volume. Vaginas are going to be talked about a lot. So this is a NSFW video. Do you know what NSFW stands for?
NSOW.
NSFW.
No.
Not safe for work.
Oh.
Gosh, you're so old.
You know, I have so many mnemonics in my head for school, I didn't know that one.
That's fine.
Okay.
All right, guys, so thanks to the wonders of movie magic, Katie is here now.
Well, hello, Katie. Okay, so we've never been more happy to talk about this subject, and although Christopher thinks we're absolutely crazy, he might walk down the hall sometimes and literally hear Katie and I talking about the vagina. So what we did to try to make this as comfortable as possible for you is we do have some medical things, but I kind of just wanted to talk to Katie about what we're experiencing in our age bracket.
Yes.
So
the fabulous 50s.
Fabulous 50s. So the cool thing about our office is we have an age range in our 20s, 30s, 40s, 50s, and we've experienced everything. So whether you're having these vagina issues,
I like it.
okay,
Yeah.
In your 30s, 40s, 50s, or even have questions in your 20s, we probably have experienced it and we probably can answer questions for you. So just give me a little bit about you and how you feel about the whole vagina health.
Well, it's important to me. I'm in my 50s, I'm 55. I've had 2 children vaginally and gone through menopause. So I'm experiencing all the symptoms, dryness.
So the 2 modalities that we want to talk about are going to be core intima and what is trademarked, the O-shots. We don't call it that, but we call it the orgasm shot. So we'll talk about both. But in vagina health, before we talk about specifics, you should be proud of your vagina, whether you've had kids, haven't had kids, you like hair, you like a landing strip, you like nothing down there.
Exactly.
You know, I think people get very vagina shy.
Yeah.
Okay.
It's a personal choice. How do
I
you like
blame
it?
society.
And if you heard Chris yell from the background, it's society. I've actually
Right.
heard on the radio, on some podcasts, talk about the vagina. And since when did vaginoplasty become a thing? Like, what's wrong if your lips, your labia doesn't look like somebody else's?
Right, exactly.
You know, embrace those labia.
Literally.
although, did you literally, right? Although, did you guys know? Here's a little fun fact that you can actually put filler in your labia because sometimes when you do age, the labia gets a little lax.
Right.
Filler's
Use
an
your
option.
estrogen.
Yeah. Katie's great with the discussion on the hormones and estrogen and everything. So if you ever want to set up time to talk with her, she's got great insight on all that. But before we keep babbling, let's talk a little bit about the 2 procedures we have here that we think are beneficial. And the cool thing is, I'm gonna take Katie through this journey.
Yes.
So she's gonna experience the 3 core intimas and then the O-shot, and then we're gonna do a follow-up video in a couple months and let you know how her journey went, but we'll take you through each step.
I'm so excited.
I know. Isn't that awesome? If there's
Yeah.
anybody else out here who's watched this video who has interest in the journey, let us know. We'll work with you, or if you're not shy about it, maybe we can work with you to take you through your journey too. That'd be kind of cool for a very discounted or possibly
a great idea.
maybe free.
Maybe. Yeah.
Yeah,
Why not?
we can talk about that. So give me some info. We wrote down a couple of questions. So before you do, tell us some things that changed with your vagina. Well, not
Wasn't
just
expecting
hers.
So one of the things I recently experienced was I went to sneeze and I automatically crossed my legs. So, and then if I'm at the gym, same thing. If I'm going to be doing squats, it's a concern that I am going to leak urine. So that's one of the big concerns a lot of women have, and it's this procedure, core intima, is great for that.
Amazing. So That's a huge one. Post-childbirth, coughing, sneezing, or getting scared on Halloween.
Yes.
We all do pee our pants just a little bit. If you say that never happens to you, you're lying.
Exactly.
But yes, this helps with that. So it's a twofold. It helps for what could possibly be things that are changing with the age, and for that stress incontinence. Do not get this confused with urge incontinence. That's something we would refer you to see your probably gynecologist, urologist, family doctor, but the stress incontinence is important.
Yeah.
So I agree. So give us a little info on whatever else you feel comfortable sharing.
Well, I think like you said, as we age, the labia changes. We lose volume. It just doesn't look like it did when we were in our 20s and 30s. And it all is because of the journey of childbirth and aging. So not only does Core Intima help with the internal vaginal health, but it also helps with rejuvenating the external labia.
So Christopher was kind enough to make me a little picture. I'm going to try to hold it up for you guys just to kind of see. These are all the parts of the vagina on the outside that might be helpful for you to understand when we're talking about the labia. We're talking about the external lips of the labia. And if you notice, there's a majora and a minora. So we like the outside and the little lip inside. So if you've ever really looked at your vagina, which I know sounds taboo.
Grab that mirror, girl.
Yeah, don't be afraid.
Yeah.
That's one thing they taught us in nurse practitioner school, is that for the gynecological exams, they should be offering you the mirror to actually watch. And that sounds bizarre, and not everybody will want to, but don't you want to know what's going on down there?
I do.
Yeah, I mean, I think that's okay to know. You could literally find a freckle you didn't know you had, or something on the surface of your skin you didn't know you had. So now if you're my age and I need my glasses, I need to leave them on in the shower to even...
Multifocal.
Yeah, so I gotta really look at things down there. You know you're in a good relationship when you can say to your spouse or significant other, hey, can you take a look down there?
They usually don't mind.
Okay, enough of the personal vagina, but the reality is we all have one. All of us female women have a vagina. So I wrote a couple questions down. I'm gonna ask Katie a couple quick things. Let's start with the basics. What is Core for? I feel like she kind of answered this already.
Right.
But on a very quick note.
3 important ones. So it's going to be dryness, pain with sex, and again, the urinary incontinence are the 3 big ones.
And I love that she did her research and I did mine, so she talked all personal issues that the Core works for, and I write down on a very medical terms, it delivers a light energy that's going to stimulate your body's own healing response to increase your collagen. Right. So by increasing collagen, everything Katie just said is going to get tighter and look, I'm going to say prettier, but be more functional as well. So it's just not pretty, it's functional. Okay. So Christopher had asked us, and so I did a little research to make it simple. What is the science or the mechanics of this machine?
So with a fractional CO2 laser or carbon dioxide laser, it makes little microcolumns of injury into the skin. When your body has an injury, it starts to heal it, and it sends technically fibroblasts to the area, and fibroblasts create collagen. Collagen, again, increased lubrication, and also will help to tighten the vaginal canal.
And it's interesting because, again, to circle to the science part of it, the laser energy will stimulate the increase in moisture in the vaginal canal, decrease dryness and discomfort during your intimate relations. So this is so scientific. It's not even just something we joke about, but science stands behind this. With the Core Intima, you do need 3 treatments. You're gonna do a treatment once a month for 3 months. You know, we'll attach at the end pricing point for this. It's not a once and done. I prefer 3 treatments to get the maximum results. And like Katie said, some women don't want to do the external, which is perfectly fine. You could just do the internal, but both are included, and I think they're both important if it's important to you. Aren't you excited to do this?
I'm so excited.
Yeah, and it's quick. It's not embarrassing. It's quick.
Would you say it takes about 30 minutes?
30 from start to finish for me to get you prepped in the room, get my machines, get everything done. There are no pictures, so you don't have to worry about that.
Shaved or unshaved?
So
Definitely shave.
You definitely want to shave.
Yeah.
So if that's not something you typically do, we do need you to do this if you're doing the external portion.
Right.
If you're doing internal, we can work around it, but it is definitely easier if you're shaved up there or trimmed up, especially for that area. All right, so does it hurt? I would tell you, all the clients that I've done, I've never had anybody say that it hurts, and it is really quick. The actual procedure part is maybe 15 minutes of that 30 minutes. I did write down a 30-minute total. And is there an age limit? What's your opinion on this?
I would say no. I say that even girls or women, I want to say women in your 20s, 30s to 60s, 70s, vaginal health is important at all ages.
Yeah, so we're very much pro vaginal health. We're not just here to fix your face. You know, a lot of our procedures we do, if we can't do them, we're gonna send you someplace that can. I'm thinking holistic health as well. If you wanna look good, you need to feel good. It kind of goes hand in hand. So the second little thing that I had,
there you go.
so I'm gonna just show you this real fast, and then we'll talk about the O shot and wrap up, since I'm sure this is a lot of information. So what Katie and I were saying is, it's kind of like having an internal ultrasound, where you will have the probe inserted into here. We'll show you the probe into the vaginal canal. So like I said, it's not painful. You know, you'll help us get it directed. We'll know when it hits the cervix, so we know when to stop. This is really as comfortable as it can be for a sensitive subject, just so you know. And we like to call it the pretty kitty. So these are a little code name in case, you know, you're not as comfortable talking about the vagina. And what I like to pair with it, and I was telling Katie, is what is trademarked as the O shot, we call the orgasm shot. We actually draw your own blood, spin it down, we take the platelet-rich plasma, and we actually then are going to inject it into, I'm gonna show you the two little areas. This sounds horrible, but please trust me in knowing it's so quick that you guys will be pleasantly surprised. So I'm gonna come back up. You'll get one little shot right there by the clitoris, and then you're gonna have another little shot right below the urethral opening, about this area. Those two shots are gonna stimulate something that is amazing. Some people life-changing.
Yes.
It is an enhancement to an already great orgasm, or for those who can't have an orgasm, it helps stimulate an orgasm. You can have sex right after.
Really?
Yeah. You can actually feel change right away. Some people have teased me about their ride home. Those bumps can be bad on our roads. But it continues to actually get better up to 3 months. And you can add additional ones in, but it does continue to get better up to 3 months. So I tell clients, you know, at least wait a month before you decide if you need another, and we can do it a couple times a year. So it's kind of cool how it works.
And I wanted to back up also, with having the core intima, there is a little downtime of 7 days not to insert anything into the vagina, just let it heal.
And by anything, she means penises,
Tampons,
dildos,
yeah, anything.
anything. As nurses, we've heard it all, but
Yes.
just keep it clean for 7 days.
Yes, exactly.
Okay. I'm not sure if you guys will have any questions for us, but we tried to cover everything from A to Z in your vaginal health area. Like Katie said, 55, 53, we're not 20 anymore, but you know, we think it's important to take care of the top and the bottom. Please reach out to us for questions. We'll add some pricing on here, and Christopher hopefully will let us give away maybe a free one for anybody who might be interested. And we look forward to hearing from you guys.
Yeah, have a great day.
Great day.